So Ed, tell us a little bit about why this is so important to Clinton Township. What are the benefits for our residents here? And I mean, this hospital's been here for many years. Why this machine, and why was this chosen, and how does that benefit us?
Well, one of the biggest reasons is that we're really advancing a lot in our cardiac surgery and also our thoracic surgery. With the technology that this robot has, with the tensions within the arms, and as they're putting in, working on small vessels, you don't really want to pull or push too hard. This will be able to tell the doctors how hard they are pushing or pulling against the tissue. The other thing that we do, that we're starting to do now, is robotic mitral valves and robotic tricuspid valves. With that type of surgery, we don't no longer have to split open the chest. We are able to use the ports, get in there, work on the heart while it's on bypass, and then close it up. And so when the patient wakes up, they only have like 4 or 5 minor incisions instead of the whole sternotomy and everything like that.
So post-op is reduced, the amount of time for healing.
Yep.
Pain, I would imagine, is reduced as well for the patient. That's huge.
Yeah.
And this is right here in Clinton Township in our own backyard, which makes it really special for our residents and for anybody in the near area, that they don't have to go out of state. They can go right here to Henry Ford Macomb Hospital.
Correct. And actually, within the system, we are getting a lot of referrals from the other hospitals within the system that have those types of cases done here.
So this has been something that you've had previously, a different version of this, the XI, the Da Vinci XI, and this adds to what you previously have offered the community, but in a way that makes it even more perfected.
Correct.
Okay.
And it gives the doctor more leeway and advantages for doing the more difficult surgery.
So talking in terms of, the lay person like myself that that never went to medical school or even focused on that, when you see these are better techniques, offers better techniques, and you were talking about pushing and pulling, and so now these surgical tools make it so that there's less impact on the actual body itself, correct?
Not so much impact, but what it really does, it gives the doctor feedback on how hard they're pulling against the tissue. So that way there's less chance of tearing or destroying that piece of tissue. And that's really important when you're doing microvascular surgeries, like open hearts. But it's also important when you're if you can imagine implanting a mitral valve, which is a valve in your heart, and you want it exactly where it needs, and you need to feel the tension within the arms to make sure that your sutures are tight enough that they're able to tack it down well.
Okay, excellent. So is it ready to go? Is this something you guys have to prep first, or can we see an example of how it works?
Right now you can see the gentleman behind me is actually working the robot as we talk. And this is just a demonstration. Obviously, we can't do a live operation out here. It needs to be a sterile field. But right now, this would be what the doctors practice on, or residents, or anybody that's really learning how to use it would start with this and then progress on. We do have, in fact, we have a doctor right now that is down in Atlanta, Georgia, dealing with how to do aortic valves and total robotic open hearts.
Okay, so they're always learning as well. And is that part of this whole program? When you receive a machine like this type of technology, obviously there has to be training. Who exactly gets chosen to be that one that trains on this, or is it limited to a certain number of doctors?
It's unique with the system that we have right now and this system. They are very similar, so there isn't a whole lot of retraining on it, because it's just a matter of getting used to feeling the tension, and also the optics are much better, so they'll have a much clearer picture of what's going on, and they can see closer and get a better view of what they need to work on.
So has this machine done operations yet?
Not here in the hospital, but it has throughout the United States.
Okay. So Ed, these types of machines and technology come with a hefty price.
Yeah.
What is the cost? And tell me also not only the cost of this investment, but why this investment was important.
The cost itself it's a multi-million-dollar machine just for one. So we are looking at one, possibly two. The other thing is that the investment goes back to what I talked about before, just the technology and the ease for the doctor, for the surgeons to use what they need to get the job done.
Okay. Well, that's a huge investment. It shows your commitment to our community, the commitment to this facility, and we really appreciate it.
Thank you.
Thank you.